our health is fragile, our economies are fragile, and the way we run businesses can be fragile. We are very happy and glad to officially announce as RERA our long-term strategic relationship with IWBI, the International Well Building Institute, by launching the Well Health Safety Rating. And by that, we mean that all the buildings that are managed by homeowners association and community management companies will be part of this program under RERA's supervision.
With the onset of the pandemic last year, we were asked by the global community to serve a role, to create a new subset designation of the full well building standard called the Well Health Safety Rating.
The Well Health Safety Rating is an evidence-based third-party verification that can work for any type of facility that focuses primarily on the operations and managerial protocols of your building. It's a comprehensive health and safety program. It's not a COVID-19 program.
It is very, very scalable, whereby one document review can satisfy for many, many, many buildings all through the one process that has scientific rigor and gives you the mark of excellence of the Well Health Safety Rating.
Everything that we do is backed by science and research. We do not offer anything to any of our clients globally unless it's validated, unless it's backed by science and research.
Does this involve any site visits, any site inspections?
So the health safety rating is document review. It's an upload of documents on policy. There is no on-site physical verification.
Now, to comply with the rating and obtain the rating, I'm sure there will be a reinvestment required for the assets.
There is no CapEx requirement.
What's the time scale once we submit?
The document review period is a 20-day process for turnaround. Once the documents are aggregated and collected.
This is a seal that you can put on the front door of your buildings to communicate health and safety. And we're putting, as you may have seen, we're putting a very strong marketing campaign behind this.
How does the WELL certification deal with the challenge of a building with multiple stakeholders, where there is a difference in control between tenanted areas and landlord-managed areas?
If a landlord is getting the Well Health Safety Rating for the building, the core and shell of the building, the landlord is only responsible for what the landlord is in control of. So the relevant criteria work for a landlord ownership, or if a company wants to get the health safety rating for their own individual office, they can achieve that as well. It's a very flexible system.
Once the certification is achieved, is there a need to recertify after a certain period of time?
It's an annual designation. The seal has a date on it to demonstrate that annual compliance, to continue to demonstrate you are currently compliant for all elements of health and safety.
What will be making the difference between a company and another, and then between a legislator and another?
This allows your organization to align with the healthy building movement. This allows your organization to align with some of the largest organizations globally that have achieved the Well Health Safety Rating seal, and it shows leadership. The Well Health Safety Rating seal is a uniform seal. So you're going to be able to go to JP Morgan Chase or the Empire State in the US and know what this seal represents.
As per the direction of His Excellency Marwan bin Ghalita, this is an important strategic project. We will support it all the way.
We want to demonstrate our commitment, so we look forward to working with RERA Dubai Land in the UAE.